Surrogacy is again an assisted conception treatment option that is of relevance to certain subgroup of patients. So first of all, to consider how does surrogacy work, it is important to understand who needs this treatment. Patients who have had hysterectomy, either for benign causes or for malignant causes, are the ones who should bear in mind that they might need this, especially when they have not completed their family by the time the hysterectomy has been performed. The other group of patients would be who have been through the cancer treatments or who have been exposed to chemoradiotherapy, and as part of these treatments the pelvis could not be protected, and that has damaged the lining of the womb where the implantation of the embryo is unlikely or hasn't happened after few treatments. Then surrogacy is something they might have to consider. The other group of patients could be those who have medical illnesses, and some of these illnesses could actually worsen, or in some occasions it can be life-threatening. Then in that case, the carrying of the pregnancy can be life-threatening. Then for such patients, surrogacy should be considered, which will give them an option to have their family without increasing the morbidity from their medical illness or even making it life-threatening. The other, obviously, it also gives a family building option to the male gay couples who want to go through, want to have their families. So after having seen into who actually needs surrogacy, what are the process or the steps that is involved? So the first step is involved is you need to see a fertility specialist to understand the complexities around surrogacy. This area tends to be more complex, more from non-clinical point of view rather than from clinical point of view. Once you've seen the consultant or your fertility specialist, you feel that this is still the way that you want to go down, then the next step probably for you would be is to identify a suitable surrogate. Once you've identified the surrogate, then you as a commissioning couple will be going through the screening tests for the infections and the genetic screening. Because when we are creating these embryos and replacing back, you're effectively acting as an embryo donor or the gamete donor. So in order to minimize the risk of exposure to the host surrogate, you are screened for a range of conditions. You may also be advised to quarantine either the sperms or the embryos based on what you prefer for a certain period of time, so the possibility of transmitting any infectious diseases can also be minimized to pretty much almost a remote possibility. So once you have quarantined the sperms, your case will also be considered usually in most of the clinics in an ethical committee, and once all these have been considered and the arrangement has been approved, then you would actually start the process of the treatment. So once you start the process, then based on the arrangement that's in place as to who the gamete providers will be, who your surrogate is, whether the surrogate is wishing to have a frozen embryo transfer or whether it would be a fresh transfer, we will synchronize all the cycles together and then take you to the treatment. So the overall processes can take from the very first step to actually ending up having an embryo transfer into the surrogate can even take up to 3 to 6 months. Sometimes it may take longer. The important points during this course you also need to consider would be it's important to take the advice of a family solicitor to ensure that you would be eligible for the parental order application that would give you the right to be the legal parent of the child. So these are briefly some of the considerations that you need to consider in mind before going in for a surrogacy arrangement. Obviously, many of these can be discussed much in detail at your consultation.